Hey everyone, big news! We've launched a brand new Beyond the Mask website, professionally redesigned to give you a better experience. It's easier to navigate, better organized, and makes it simple to find episodes, explore our exclusive series, and access helpful resources for CRNAs, including CE credits and the 1099 CRNA Institute. Check it out at beyondthemaskpodcast.com.
Welcome to Beyond the Mask. In this episode, we're shining a light on a growing concern: how aesthetic treatments like Botox and dermal fillers can complicate anesthesia care. While often thought of as a routine cosmetic enhancement, these injections can mask underlying muscle responses, alter facial anatomy, and even create unexpected risks when managing the airway. As more patients present for surgery with a history of aesthetic procedures, anesthesia providers must be alert, informed, and prepared. Today's discussion takes a cautionary look at what every CRNA and anesthesia professional should know when aesthetics meet anesthesia.
CRNA Financial Planning is a sponsor of Beyond the Mask podcast. Investment advice offered through Private Advisor Group. Nothing in this podcast should be construed as investment advice. Plus, did you know listening to our podcast can earn you Class B credits? For details on how to submit, visit the CE credit section at beyondthemaskpodcast.com. Welcome to Beyond the Mask, innovation and opportunities for CRNAs and advanced practice nurses, with certified financial planner Jeremy Stanley and CRNA Sharon Pierce. Jeremy Stanley has worked with CRNAs for more than 23 years, and Sharon Pierce is a former president of the AANA and the NCANA. Join us as we leave the operating room and learn the latest in the CRNA and advanced practice nurse industries. Beyond the Mask starts in 10, 9, 8, 7.
It's interesting. That's hard to say. Aesthetics meet anesthesia.
Oh, no, it sounds like a date.
It does.
It's a date I've had before.
I've never had it before. So.
Well, we can fix that. We can talk you right on up there.
There you go. There you go.
You got some crow's feet that needs a little work.
Okay. Well, now you've given me a complex. So, all right. We have Krystin Jones back with us. Krystin, welcome.
Hello. Good morning,
You're
everyone.
a repeat offender, aren't you?
I am.
Yeah. Well, we're welcoming you back to the show. And for those that might not know you from your first episode, why don't you give us a brief background about who you are and where you're from?
My name is Krystin. I am from Concord, North Carolina, right outside of Charlotte. I am currently a student in Duke University's nurse anesthesia program. I'm a senior there right now. My background, I was a baby nurse at Duke. I worked in the neuro unit as well as the cardiothoracic ICU, did some travel nursing in Charlotte and the STICU, went up to Albany, New York, and did some travel nursing, and now I'm back in school.
Okay. All right. Albany, New York. You decided you wanted to come back down here, though, right?
Oh, yeah.
Yeah.
That was a culture shock.
Oh, yeah.
I'm speaking at their program next
are you?
March.
Oh,
Mm-hmm.
yeah.
I'll
Albany
show you
is
them in their
beautiful,
leadership
at
track.
certain times of the year, but in the winter, no thank you.
I know.
Every
it's
day I
supposed-
woke up and it was snowing again. And I
I
was
know.
like, oh, my gosh.
I'm wondering how the travel will be because I'm supposed to be up there in March.
Oh, it'll be snowing.
Well, it'll be fun. I get to go and I get to leave.
There you go. That's right. You don't have to stay. So, Krystin, let's talk about this topic here. And, what inspired you to look at this?
So it was actually one of our classmates, and she was like, why don't you look at Botox? That'll be interesting. And I was like, how did I not think of that? Because my sister works in the aesthetic world. And then I really started trying to help her out more and look at what she does. And while the talks is super interesting, super important, even more interesting to me was the fillers that are being used and how they can be used to change people's facial anatomy and structures from what we can see on the outside. I've seen people go in, and when you're at the grocery store, I feel like I'm looking at people and
their
you're just
airways.
like, yeah, and I'm like, oh, you're a little bit of a red flag.
Yeah.
And I would see these girls walk in, I'm like, they're a little bit of a red flag. And then they would come out and they would have, I would not be worried about their airway at all once they came out when they would get these fillers. And I was like, wow, I need to look into this more because I feel like it could be something that could be a hot topic and could cause issues for us later because it's just growing and growing and growing in popularity.
Mm-hmm.
Okay, I'm going to ask a dumb question.
Okay.
What is a filler?
Well, a filler is something they put in the face to change how your face looks. For instance, you can have filler put in your cheeks and it'll pull your cheekbones up, and it gets rid of these lines, the marionette lines around your mouth, and makes you look more youthful, because as you age, your face flattens. Gravity pulls down on your face.
Right.
So you put the fillers in, and I used to work at a plastic surgeon's office, and then whenever they would finally come for their facelift, when you peel their face back, you can see it, and you got to scrape it off.
Oh, wow.
What is it? Is it like gel
I can never
or
say it.
something?
Hydrant. You can
Most of them are hyaluronic acid. There are a couple different kinds, and they're constantly coming out with new things on the market. And I'm sure you've heard of lip filler.
Yeah.
Okay, so that's kind of like the most common one that most people know about, but now it's being found that it can be used in the cheeks and under the eyes, like
up around the temporal area. Create a jaw. I mean, you can go in and you can feel enough, and they can go in and look like they don't have a jawline, and now they'll have a jawline. But they use Botox also and put it in their jaws to slim their face, the muscles.
Wow.
A lot of girls now are getting Botox in their masseters, so it really slims the face and helps to create that jawline, as well as getting the chin filler. So it's creating like that full jawline look for them.
Hence your comment. Now I understand, because my wife always looks at people and she'll say they don't have a jaw and their neck is this. And so if you alter that as an anesthesia professional, then you're looking at that going, oh, they're going to be fine. And they might not be. Okay.
Exactly.
I'm
well,
with you.
One of my daughters has got a chin implant.
Right.
Because of the wreck that we were in.
Yeah.
And it flattened her palate. We had to work on her lips, chin implant. But I tell her all the time, if you have anesthesia, you need to tell them that you've got a chin implant, because it changed the total look of her face.
Wow. Interesting. Okay.
Yeah. Talk about the Botox.
Yeah, so Botox is also super interesting. So we do neuromuscular monitoring, as we all know, putting to sleep. It should be routine for everyone to do a baseline train of 4. Make sure you see 4 out of 4 twitches before you're giving anyone paralytic. But I feel like most facilities I've been to, it's not the routine, because we don't have
99%.
Fancy, yeah, we don't. And if you're at a big facility, you might have the fancy Senzyme where it's just convenient to do it. But at other facilities, it's not. And that's a budget thing, because they're expensive. So anyways, we're not getting a baseline train of 4. Then you might be doing something like a robotic or a laparoscopic case, where it is vital that these patients are kept flat. We call it 0 out of 4 twitches, paralyzed, because the surgeons need complete immobility to do these procedures. And with these instruments inside the patient's body, if they were to cough or wake up, it could be catastrophic. So as we're checking neuromuscular monitoring, you might check them again. It's been 30 minutes. Maybe it's time to give them a little bit more rock. We'll see. Check. They're still 0 out of 4. Okay, we're still good. Check 30 minutes later. We're still flat. Okay, we're good. And they could have full twitches back at this point. There's several case studies that show people were getting 0 out of 4 twitches, and then they switched to the ulnar to check, and they were actually getting 4 out of 4 with no fade. So they were completely back from their rock, and on their forehead there was 0 out of 4.
Because of the
tox.
The neuromodulator had their muscles paralyzed, right?
Right. Okay.
And I mean, we all know we treat people clinically, and I use the facial nerve all the time. That's a lot of times the only options we have, and we don't have quant monitoring where I work at. And you'll see them start breathing a little bit, and you've got to redose them, but they'll still be 0 out of 4 twitches. And we've got some old monitors there, so a lot of times you just say, well, it's an old monitor, or maybe the battery's a little dead, whatever. But it never, and you would think, I inject Botox, I do this, that it would have crossed my mind that they were toxed up. I mean, Jesus, I'm toxed up, for God's sake. And it never crossed my mind about this until I heard her lecture yesterday.
Interesting.
And so, it's a thing.
Yeah, and I mean, we're very familiar with Synzyme. I mean, we've done a podcast with them and Richie, and, it's interesting to me, looking at it from the outside, why there is not more of not just Synzyme. I know there's other people out there that do it, but those monitors that will allow you to make sure that patient is not
right.
moving.
Well,
anyway,
that's a whole other podcast.
Other story. Yeah.
But the thing is, nobody's telling and nobody's asking, and some people are really funny about people knowing that they've had any cosmetic procedures done.
Yeah.
To me, it's like you ask somebody, do you smoke? No. Do you vape? Yes. They don't think that
it's the same thing.
It's not the same thing, or they think it's not important. How many times did you ask somebody, have you ever had surgery before? No. And you can see the implants sitting on their chest.
Yeah.
They don't put those things in people when they're awake, but they don't think that cosmetic procedures
matter
or are actual surgery.
Yeah, they don't think it's important, so they won't bring it up. So that's why one of the biggest things I try and harp on is you have to ask those closed-ended questions. Have you ever had any aesthetic procedures like tox fillers? Have you ever had plastic surgery? Because you're right, people just... It's not because they don't want to tell us, which I will say, I think there was a stigma with toxin fillers and all that years ago, and now it's much more accepted.
Right.
It's just part of the norm now, really. I feel like more people are getting it than not, almost.
Yeah, and younger people, too.
Yes.
I mean, my girls, whenever I'm going up, they're like, Mom, you're bringing the tox with you, aren't you?
Yeah.
I need to be toxed.
Yeah.
So I'm carrying it with me.
Interesting.
You've probably wondered at some point, should I stay W-2 or go 1099? And more importantly, what would that mean for my income? AANA has launched a new 1099/W-2 income comparison calculator designed to help you compare W-2 compensation with potential 1099 earnings in just minutes. It also helps you understand how taxes, deductions, and expenses could impact your take-home pay. It's a quick, simple way to get a clearer picture of the numbers before making a career decision, whether you're actively considering independent practice or just exploring your options. Try the 1099/W-2 calculator today and see how your potential earnings compare. Visit aana.com/1099 calculator to explore the tool, or check this episode's description for the link. The 1099/W-2 income calculator, helping CRNAs better understand the financial side of their career choices. Remember, that's aana.com/1099 calculator.
So, I mean, I'm going to ask you what surprised you most about this, but what just surprised me is to hear what Sharon said, that she really didn't think about this until your lecture.
Actually, I might
me.
put together a lecture on this too and go just a little bit deeper than this. I trained under Suzanne Jaggers.
Oh yeah, that's right.
Remember we interviewed Suzanne, and I went and I took her course on toxin filler. I don't do any filler because you got to keep I can never say the word the thing in case you get a vascular.
Oh, yeah, the vascular
occlusion. And, I just kind of do this for play and for friends and me and my daughter.
You do yourself?
Yes, I do.
Wow, really?
Yes, I do. Pierce knows. He'll walk in and I'm standing in the mirror, usually on a Sunday morning whenever I know that I need some, and I'll stand in there and I'll have the dots of blood coming out. My face is all jacked up. Yeah. But he's used to it. He's used to me doing it. I used to have a girl who would do it for me. She was a friend. I would take her my tox and she would do my face. She said, friends don't let friends tox themselves. But now she's given it up, so I have to. I had my masseters done one time and I did not like that. Now, it looked good because it did slim your face down, but when you were eating food, the food would get down between your jaw and your gums, and you would have to use your tongue to get it out because you just couldn't masticate properly in my mind, which then you don't want to eat in front of anybody because you look like.
I thought you was going to say it like kind of fell out and you were drooling down.
No,
you know?
it wouldn't come out, but it would get in between.
Oh, that's got to be aggravating.
It was
get
very
out.
aggravating, and I swore I would not do it again. I would starve myself if I wanted my face to look skinny, but I was not getting my masseters. But my same daughter, she gets hers injected because the accident, because she took such a blow to her mouth. She has TMJ, and so she has to have hers done for her TMJ.
Yeah, my sister actually does the talks for several of my classmates for their TMJ because the stress of school and everything. It was getting so
Ask
much
them,
worse.
do they have problems chewing their food, and if it goes, and maybe they've learned how to deal with it, and But I just found it interesting, and now the whole universe knows that. I'm a guinea pig. I'll try. I'll try anything.
So Krystin, what did surprise you the most about this?
One was looking at just how popular it is. I knew it was super popular, but seeing how fast it's growing is super shocking.
Amazing.
Well, I mean, I was just sitting here listening to you say your classmates, which, I mean, I've been to your class. I mean, your cohorts are not old.
Yeah.
Well, they tell you
any
stop
stance.
making collagen in your face at the age of 28.
Really?
You've got to start early.
You have to start early, but there's a different tox that you use. Normally, you use Xeomin, which is
What?
Xeomin. It's don't you look at me? Don't you look at me? Jeremy, it's almost Sunday. Chill out.
Well, I did not know what you said. I apologize, but I had no idea what you just said.
Oh my God. It starts with. Anyway.
Is my face red, Krystin?
A little bit.
It starts with X, not S.
Okay. All right. Good.
But it's a kind of a baby tox that you'll start using on them whenever they're in their 20s, because it's just like any other muscle. If you paralyze it, it will atrophy, and you want it to atrophy. I used to have the tox didn't come out till I was 42, somewhere along in there. The 11s, I mean, I could crack a walnut between my eyebrows. I had my muscles were so strong. Even now, I'll have to retox probably every 6 weeks to make sure that I don't get the 11s back. And one of my daughters is just like that. I have to tox her about every time I see her
Oh, wow.
because it's just such a strong muscle.
Wow. Interesting.
You are learning so much
I
about
am.
me that you
I am.
didn't even
I'm
know.
like, true.
You thought you knew me well, right?
Yeah.
And you do.
Wow. So, Krystin, how can the anesthesia providers that might be listening to this, how can they use this in their everyday practice?
I think just to be aware that these procedures are being more and more common and that age and gender do not discriminate. There's a bunch of guys getting tox now. They're even getting fillers.
Really?
There's
That's
girls.
true. The
Yeah.
first in one of my classes I went to, the first person I injected was a guy,
And they take more tox.
and they do. I've injected my son too.
Like what age? Like what age do guys do this now?
I mean, there's guys in their 20s coming in, and
Yes.
it's more so, a lot of the wives that are in their 40s, 50s, 60s getting tox, they're bringing in their husbands to get like under eye filler. I mean, they're getting all sorts of things now.
That blows me away.
Yeah.
I've never even contemplated anything
Oh,
like that.
after we get off the air, I'll tell you something else.
Oh, okay.
Yeah, but I think just being aware that these things are becoming so common and that anyone can be getting them, and with the techniques that these injectors are using nowadays, it all just looks so natural.
It does.
And you can't tell, so you shouldn't assume that someone has or hasn't had something. Just include it in your preoperative assessment really quick. Hey, have you ever had any aesthetic procedures? Have you ever had any tox, fillers, any plastic surgery? Because I have never seen tox, fillers, anything like that, aesthetic
chart.
procedures, in a patient's chart. It's never there. I've seen tox there maybe if someone gets it for migraines, or if they're getting it for something medical, but never for aesthetic purposes. And that's kind of the tox that is affecting us the most is when it's being used for aesthetics. So yeah, just being aware, and then also adjusting your anesthetic if you find out something. I think something super important too, looking at these pictures of the before and afters. I had several people after my talk yesterday come up to me and they were like, I wasn't super convinced, and I saved the pictures for last. I call it when looks deceive. They're like, those before and afters were crazy. You're right. Like, I would be super worried about the airway before, and then after they looked just fine.
They did.
Wow. That's
so making sure to adjust your anesthetic, and if someone has gotten chin filler, maybe ask, do you have any before pictures to kind of see like what you were working with their original anatomy? Because we're changing what's on the surface, what we can see, their underlying structures are not changing. So it's super important for us to prepare and maybe have a glide scope at least sitting outside of the room, and just being a little more prepared and changing what you're doing to make the anesthetic safer. Because if you're in a more rural facility where you don't have 5 people that can run in there and help you whenever you look in the mouth and you're like, oh, I only see pink tissue, when it was someone you looked at from the outside and you weren't worried at all. And now you can be in an emergent situation, because sometimes those people aren't easy to mask either.
Right.
So.
Yeah. Wow. I mean, I was just sitting here thinking, if you ask somebody to see a picture, and I was thinking of my mom. I had to take her to get a procedure done the other day. They're taking her back in there, and I heard the lady ask her that if she would step up on the scale. And my mom was like, what? No, I just weighed myself yesterday. We were out in the lobby, and I was like, she is not going to get on that scale. And I heard the lady say, well, I guess you can just tell me what you weighed yesterday then. But it just made me think, like, would they actually show the pictures? Like, some people would not do it because they're like, oh, no, I ain't got no pictures.
And at that point, I would definitely have a glide scope. I would have a McGrath. I would have something, because if it was that big of a drastic change, then you should just do whatever's safest and be prepared.
Yeah. Sharon, do you ever ask if people had cosmetic surgery?
Well, a lot of times I can tell. Anyway, but I was telling Kristen about a story. I was working in Cary, and that's kind of an upper echelon down. And I had this doctor's wife, and I had asked her if she had had any procedures done, ever had any surgery, anesthetics. No. Put her to sleep. It was just for a colonoscopy. And I looked behind her ears, and she had some scars behind her ears, and I knew. So when she woke up, I said, are you sure? I said, it looks like maybe you had some facial work done. She said, I just had my neck tightened. They do not want to tell you.
And it depends on the age too. I think
you've had that they've had a facelift. Yeah. They don't want to tell you.
And I think for people listening, if you're not in the anesthesia world, we are not here to judge. We are here to make sure that you are safe and that we're taking the best care of you.
Listen, I would be the last person to judge.
Yes,
I had a lot of stuff done. So I'm okay with it.
That's wild. Again, I'm just me. I have to process, but this seems like, in my mind, because we have listeners all over the world, 125 different countries and so forth. But
in sub-Saharan Africa, and we have a lot of listeners down there, they're going to be going, Americans are doing this.
What? Because this seems like an American problem to me.
It's a European problem. Let me tell you what. You go if you know what you're looking for. I mean, if you want to do filler and just do filler, go to Europe, because everybody's got jacked up lips over there. Everybody.
Interesting.
Everybody. And they overfill them too. Big time.
I noticed that a lot when I was in Italy.
Yeah.
A lot of filler.
Interesting. Well, this has been, I've learned some stuff here today, Kristen. I'm not going to lie. Then one of them starts with a Z that I'll probably never forget.
X.
I will say, after the talk,
it was a Z.
It was an X.
After the talk yesterday, I had so many men approach me, and they were like, "Wow!" Had no idea.
Yeah.
And of course, all the girls were excited because we all love talks.
Yep. Yes, we do.
Well, as we wrap up, Krystin, anything else you want to say or get across to our listeners before we close?
I think the biggest thing, just include it in your preoperative assessment. Have you ever had tox fillers, aesthetic procedures before? It's much better to take that extra 5 seconds to ask a question when the room is rushing you. Come on, turnover time. Oh, it's anesthesia's fault. We're 30 seconds late. It's okay. Just keep your patient safe. Ask these questions. It's not offensive.
To you, it might be to them.
Might be to them. Yeah. All right. Well, Krystin, listen, thanks for being back on the show. Thanks for this wonderful information, and if you can bring something new to Sharon, I think that's saying something. So great topic, and you did a great job. So
Thank you
for
so
being
much.
Here. All right, Sharon, I think it's a wrap.
Thank you for tuning in to Beyond the Mask. If you enjoy the show and want to help us grow, the best way to support us is simple. Leave a review on your favorite podcast platform, share the show on social media, and tell your friends. Your word of mouth is what keeps us going strong. We're proud to consistently rank in the top 50 medical podcasts nationwide and to be #1 in the CRNA community. All thanks to listeners like you. Your support helps us stay there, and we couldn't do it without you. We'll see you on the next Beyond the Mask.
Hi, this is Jackie Rolls, President and founder of Our Hearts, Your Hands, a global support anesthesia community. We'd like to thank all of our prior donors and also say that we are accepting donations, welcome donations, to send a nurse anesthetist or even a nurse from a low-resource country to get further academic education or attend professional conferences or even equipment for some companies. Thank you so much for your support.